you may start.
Yeah, hi, good afternoon, everyone. Yeah, today my topic is on Lingzhi and kidney protection. Next, please. Okay, first we start off with a disclaimer. So all the information contained in the slides are actually intended for general health information and educational purposes only, and are not intended to be used as a substitute for professional medical advice, treatment, or care. Yep. Okay. So, what is kidney? So actually, kidney is a two. Yeah. So for function of a kidney, so the main function is actually filter and remove waste from our blood. Okay, like urea and creatinine. This urea and creatinine, they are actually waste product from our body metabolism process. So the next is it regulates and maintains fluid and electrolyte balances in the body. So like water, sodium, potassium. So kidney actually helps to remove excess fluid, and thereby our body can actually maintain the balance in the electrolyte. Uh, Electrolyte are actually mineral that carry an electric charge. They are involved in many essential processes in our body. Yeah. So without this without this balance, that our nerve, muscle, and other tissue in our body may not work normally. Yeah. So another function of kidney is to make hormones. Yeah. So erythropoietin is also known as EPO, is for red blood cell production. So we actually this will actually stimulate the bone marrow to produce red blood cell. So if the body doesn't produce enough EPO, severe anemia can occur. So the next hormone that the kidney will produce is a renin. So this renin is to control the blood pressure. So renin is actually being released in the blood to regulate the blood pressure. The other hormone would be the calcitriol. For actually, it's mainly for calcium absorption from the gut and reabsorb from the kidney. Yeah. So now we look at the fact and the statistic. So it's quite scary that every 5 hours in Singapore, there will be one new kidney failure patient. Yeah. So these are the data based on 2016 statistic. So as of December 2016, there are 6,700 dialysis patients in Singapore. Yeah, and Singapore ranked top 10. Okay, in the top 10 range. Fourth in the world for prevalence of kidney failure. Prevalence of this kidney failure meaning that given a population, how many of the so-called individual having this so-called disease. So we rank fourth. It's quite a scary one. So six in the world. Okay, we rank six in the world for new cases of kidney failure. So these new cases is actually given a period of time. How many new cases being added on to the numbers? So it's quite alarming to see this number, and is if you now observe around the neighborhood, okay, you can actually see more and more dialysis center around us. Yeah, setting up. Yeah, next. Okay, for kidney failure. So in most cases, kidney failure is caused by health problem that have done permanent damage, okay, to our kidney little by little over time. So chronic kidney disease is a damage to the kidney that is irreversible, meaning there is no comeback. So how good the kidney condition is based on the kidney filtration rate, called the glomerular globular filtration rate, EGFR, and it shows how well the kidney are filtering. So this is a EGFR marker taken from the blood test. So the higher the number is better. So there are 5 stages for kidney classification based on EGFR. So the healthier kidney should have the EGFR reading at 90 or more. Yeah. So if the reading is in the range of 60 to 89, it is considered as mildly reduced kidney function. Okay. When the reading is lower and below 60, it means the kidney start to have problem and causing poor filtration. So once the reading, okay, is below 15, doctor will actually ask you to go for dialysis. Next. Okay, now we look at the symptom and complication and causes of the kidney failure. Okay, for the symptoms, okay, actually, you will actually start to see reduced amount of urine. Okay, so having swelling to your legs, ankles, or any of the body, feet. Okay, from retention of the fluid, because our body having too much water that is not actually passing out. Yeah, so it causes all this water retention. So so it's stay in the body, the water will stay in the body for too long, and it becomes this problem. And also unexplained shortness of breath, excessive drowsiness, or feel very tired, fatigue, yeah, persistent nausea, confusion, okay, pain or pressure in the chest. Okay, so the complication. Next, we'll look at the complication. So the complication will be just now mentioned about the fluid retention, the swelling. So based on that symptom, it get worse and it become very much like everywhere you start to see, especially on your leg, you will start to see swelling, yeah, because of water retention, yeah. The other one will be cardiovascular disease and anemia. So this anemia is that the lack of the so-called enough red blood cell that causing all these problems. Later we'll talk about this. And next we'll talk about cause. Yeah. So the cause is that due to high blood pressure and diabetes. So these are the so-called most of the problem having this health issue. Infection or inflammation. Now one, it will be autoimmune disease, which is example SLE, lupus. All these will actually attack your own organ. So kidney is one of the organ that they attack. And then the obstruction of urinary tract due to enlarged prostate for men and kidney stone. Yeah. So the other one will be because of a drug and toxin. So all this because of drug and toxin, it need to be actually clear away, okay, from your body, but it stay inside for too long. And yeah, and then it actually cause all this. Yeah. But do take note that having one of the health problem that can lead to kidney failure, but it doesn't mean that you will definitely have kidney failure. Yeah. Next. Okay, now we look at test and diagnosis. Yeah. So the first test is doing the urine test. Okay, they call urinalysis. So they will actually start to do abnormal protein, sugar, okay, red, white, red and white blood cell, and high level of bacteria. So a urine test is to check for albumin. The albumin is a protein that actually can pass into the urine when the kidneys are damaged. So a healthy kidney doesn't let albumin pass into the urine. So the urine test can actually detect all this. Having sugar in your urine is usually a sign of so-called high blood sugar level. This extra sugar in the bloodstream is usually removed via the kidney. But over time, high sugar level in the blood can cause this blood vessel to become very narrow and clog. So without enough blood, kidney become damaged, and albumin, all this will start to pass through the filter and pass it and end up in urine. Yeah. Next, we look at another test, which is the blood test. Yeah. So for the blood sample, actually the blood test is to check how well your kidney are filtering your blood. So for filtering the blood, there are two. One, they are looking at the urea and the creatinine. Urea sometimes they also call BUN, blood urea nitrogen. Okay, so there is a range. Okay, for this blood urea BUN and creatinine, the number the lower the number is better, and it should stay within the required range. Yeah, 7 to 20 milligram per milliliter. Yeah. So creatinine also there is a range. Yeah, 0.7 to 1.3. So for EGFR is the other way. EGFR is a rate, is a filtration rate. Okay, it's supposed to be the higher the better. Yeah. So greater than 60 would be so-called for normal function. So should not lower than that. Yeah. But the higher the number is better. Next, we look at the another test will be the so-called for detailed scan. So this one will actually have the ultrasound, MRI, and CT scan. Yeah, for kidney. Next. So for the treatment, yeah. So medicine to control the cause of symptom, reduce the complication, and slow the progress. Okay. For high blood pressure and lower the cholesterol level, and because you need medication to actually control all this. Okay. High blood pressure, you need a medication to lower it, and lower cholesterol. Also, you need to actually lower the cholesterol level, because high blood pressure and high cholesterol can actually narrow the blood vessel, which eventually damage and weaken them, and throughout the body. So it includes the kidney. So and the narrowing reduce the blood flow also. Yeah. So next, for anemia, you also need to actually have some treatment, medication to actually to make enough red blood cell. So doctor will actually inject the man-made version of the EPO, yeah, to let the body to build sufficient enough red blood cell, yeah, so that you won't have the anemia. The other one will the medication to actually relieve the swelling, so that less water stay in the body, yeah. So last one will be protect the bone. So because of the kidney not making the hormone calcitriol that affecting the absorption of the calcium, so you need medication to actually protect the bone. Yeah. Another treatment, okay, will be go for dialysis, end stage kidney failure. So for just now I mentioned about based on the classification GFR, less than 15, doctor will actually go ask to go for dialysis. Okay, so there are two types of dialysis. Hemodialysis, this is an artificial kidney patient. They go through the cleansing. Yeah. So the other one would be the peritoneal dialysis. So this one, the belly will actually there is a so-called a small little hole for them to actually plug in the plug that go for natural filtering. Yeah, this one can be done where at home. It's more easier. The first one you have to actually attend, go to a clinic or go to the so-called dialysis center to do it. Yep. Now next. Next is the last option would be the kidney transplant. So this one will be for the end stage kidney failure. Okay, failure of the transplant kidney. So 4% within 1 year after transplant, there'll be another one will be 21% of cases 5 years after transplant. So the rate is at this 4% and 21%. Yeah. So this transplant also have to be done to see whether your body there's a matching. Yeah. So currently, the only close relative or those in the family, yeah, sibling that can have this so-called kidney allowed for kidney transplant. Yeah. Next, we look at how to prevent. So for prevention is that there's no foolproof, but choose a healthy diet, uh, which is less salt, sugar, and potassium food. Salt is important, okay, for controlling your blood pressure, okay. So because the salt, more salt you have, actually they actually tends to increase your blood pressure, and this is bad for your heart and your kidney. Salt also cause your body to hold onto, okay, too much fluid and make you more thirsty. Yeah. The other one is to maintain normal body weight. Okay, BMI less than 25. And the third one will be physically active, meaning that you can actually do exercise, get active. And getting exercise is good for you, even if you have chronic kidney disease. And regular exercise can actually help to lower your blood pressure and maintain muscle tissue and help you to feel better in the overall structure. Yeah. And of course, do diligent, okay, follow the instruction of the doctor to take medication accordingly. Do not anyhow try, okay, those medication that you think is or believe in the lab saying that it's good. Yeah. So this one very important. Do not anyhow take any out of counter or any drug from anywhere. Yeah. Follow the instruction of the doctor. The other one will be TCM. So in TCM, they actually believe in they found that eat more black food to actually help on the kidney. Yeah. Yes. Okay. Now we look at the TCM perspective. Okay, in TCM perspective, the five element theory. So this five element uh, actually refer to the actual five elements: the wood, fire, earth, metal, and water. So there's a generating cycle. It means that one element generating another element. Example, such as the wood will actually generate fire. Yeah, that's what it means. As for the controlling cycle, what it means is the one element is closely related and mutually dependent to another element, such as you look at the picture, kidney, okay, and the heart. They are closely related to the blood, where heart is to govern the blood and kidney store the axon. So the kidney axon can then transform into blood, and the blood can transform into axon. Yeah. So in TCM perspective, our body system and organs are all interconnected and related to in according to this so-called five element theory. So any illnesses are in imbalance in the body function, blood, qi, all these if you are not balanced in that so-called five element structure. Okay. So uh, in TCM, okay, kidneys store axon. That's how we mentioned. Yeah. So kidney store axon and govern the qi. Okay, is involved in the growth and development of our all body. Okay, and reproduction, infertility. Okay, and impotence. Next will be water metabolism, and they maintain fluid balance in the body. Then the next one is a bone and marrow. Okay, they provide bone structure and the marrow on the so-called blood cell, and also they provide, okay, store the axon to actually involve in the brain development. And the next one is that hair, okay, growing of the hair, thick and so-called shining and all this, and nourishes and moist our skin. Yeah. So kidney actually store all these essence that involved in all this, and these are the things that actually govern the qi. Qi actually in you can't actually see physically, but for example, qi, if you can think of it, blood vessel, we can actually look at the so-called example. If you look at road, you can actually see the actual road. For qi, it's just a so-called, give you an example of a aeroplane. If you're flying, if you look at aeroplane flying from point A to point B, you can't see the part unless they actually fly. So qi is something like that. They also flow from one A to B. Yeah, but only thing you can't see, but they're actually flowing in our body. Yeah. Next. Okay, TCM perspective on the kidney weakness. So kidney weakness, it will actually show up. Okay, in first you will see the weak bone. Okay, what they believe is weak bone, your muscle and tendon, and loose teeth. So the other one will be impotent and infertile. So your sperm will lack vitality, weak uterus, and also irregular period. This is mainly for women. Yeah. And water retention and have urination problem. So because you can't hold, your bladder can't hold, or those kidney failure will start to actually try to filtering effect is not there. The water keep coming out, okay, or not able to water, not able to actually sufficient to move the water out. Okay, so your urine become intermittent, hence to have so-called so-called urination problem, and you have pain in the waist and knee, and now one just now we talk about it actually absence on the hair. So loss of hair is another weakness that it show up, thinning and baldness, and weak hearing, and forgetfulness and insomnia. So you don't have very good sleep, yeah. So it tends to forget, and complexion will actually see a bit dry and dark. It's different from the kind of color that you see in different races, but you can tell that it's no good. Okay, it's no good because the whole thing you look at it is not a natural kind of color. Yeah. So difficulty in breathing, uh, tends to have cold limbs. Yeah, the bottom now will start to feel cold. You need to wear socks most of the time. So abnormal child growth and development. Yeah. So next. So for kidney protection. So to protect the kidneys in TCM perspective, it's suggested that to avoid drinking cold water. So TCM believe that all food and drinks should be taken at normal body temperature. So it's bad for your stomach and spleen. So it will cause, why? Because it will cause poor qi flow and blood circulation. And the body need more energy to bring the temperature of the ice water up to the body that can accept it in a very short time. So as you can see just now from the previous 5 element theory, spleen and kidney is closely related. Yeah. So next will be avoid excessive activity when it detox during the period of 5 to 7 p.m. So try not to go for so-called kind of a very excessive exercise. Yeah, just during the time kidney is starting to detox. The other one will be not excessive sex activity. Yeah, and next is emotionally. So great fright can impair kidney energy. To overcome it, okay, try to have some activity involve thinking. Yeah, so that will actually help to overcome emotion. Yeah, and eat natural black food and black color vegetable, including black fungus, mushroom, seaweed, and black sesame. So these black fungus, those are black color fruits, also good, including dried longan and purple grape. This is in TCM perspective, yeah, for kidney protection. Okay, now we talk about the so-called Ganoderma, so-called Lingzhi. So Ganoderma, also known as Lingzhi. So it's a very special type of mushroom that has the healing property. It has been recognized as a medical mushroom for over 2,000 years, and its powerful effect have been documented in the two oldest medical books in ancient China, 《神农本草经》and 《本草纲目》. Yeah. So in the last 50 years of modern scientific research in Lingzhi, we can find many evidence-based report published. So if we do a Google search, the keyword Lingzhi or Ganoderma and diseases, we can actually easily get more than 1,000 search results. Okay, and most all the report can be found in the PubMed website, which is the U.S. National Library of Medicine. Yeah. So when it comes to selecting Lingzhi product, you will be swiped for choice in the market. So why would you choose Shuang? Okay, first, Shuang is one of the world leaders in producing top quality Lingzhi. Okay, and their main core business is in research, produce, and market the Lingzhi. And the company has been in the business, okay, for this core business for 32 years, more than 30 years, and specializing in producing top graded Lingzhi product. Head office in Taiwan, and the name as Double Crane. Okay, in South Asia region, is named as Shuang, and the company owns their in-house R&D, Lingzhi farm, as well as the distribution network. So to many years of research effort with this patented extraction process, all Lingzhi products are extracted with the two unique components, catechinoid and micromolecular polysaccharide content. So, and the product have been certified, scientifically certified with various endorsements, okay, and TQF, HALA certified as well as ISO. In Singapore, we have HSA. Yeah. Yep. Okay, now we'll look at what the function and benefit of this Ganoderma can help us in all the body system. Yeah. So number one, regulate immune system. Stimulate immune cell to prevent infection and inflammation. So regulate immune system to prevent autoimmune attack. So why our body immune system need to be regulated? It's because if it's too high, you will have autoimmune problem. But if it's too low, you'll get infection easily. So Lingzhi can help us on these two aspects. Yeah? So number two, improve blood circulation. So this improve blood flow. Yes, this is important as a blood circulation is like the so-called transport system that help us to deliver oxygen and nutrient to the whole body. Yeah. So any part of the system will be at risk if they don't get their required oxygen and nutrients. Yeah. So improve blood flow, reduce blood fat and glucose, and improves the blood vessel elasticity for better control of our blood pressure. Yeah. So this blood pressure is actually related also to the kidney problem. Yeah. So it's very important that we have to ensure that the blood pressure is being controlled. So third is enhanced liver function, detoxification. So this eliminate toxin from the liver. And when liver is able to do the toxification, okay, with the blood, so it will actually have a downstream effect to lessen the burden for kidney on this detoxification, so that they can actually be more effective and even better for the filtration. Yeah. So both will be remove free radical and anti-oxidation. Yeah. So because of the free radical can cause damage to DNA, and these are linked to many diseases, diabetes, heart disease, and worse is cancer. So so reduced free radical attack also to the kidney. Yeah. Um, the reason why Lingzhi is so unique that has all these function and benefit is because there are two major components. Just now we mentioned about the unique is one is the terpenoid and the micromolecular polysaccharide. Yeah. So now we look at the so-called evidence-based research. Yeah. So this study actually found, okay, for Ganodermal can suppress inflammation. So this study actually found that Lingzhi can suppress inflammation. Lingzhi can help on the kidney disease, as inflammation happen at the nephron, which is the function unit of the kidney. So suppression of this inflammatory response by terpenoid isolated from mushroom Ganoderma lucidatum. Yeah. So this is the so-called evidence-based research. Next, we look at another research. Yeah. So another one will be the show that Ganoderma improve chronic glomerulus nephritis related to renal damage. So this glomerular nephritis is the inflammation of the glomeruli. So this is the glomeruli is the one that after the so-called after the filtering that on the filtering part, okay, then from the kidney, actually resulting in poor filtration rate and eventually leading to chronic kidney failure. Yeah. So Lingzhi has very good effect on this so-called uh, um, protection. Yeah. Okay, comparing with the health, now we look at it continue from the other one, the research. Lingzhi improve chronic uh, glomerular nephritis. Okay, comparing with the healthy structure of the kidney, it shows that the Lingzhi can actually help to reduce the inflammation and actually maintain the structure of the kidney. So from the left column, you can see the normal structure of the so-called glomerulus, okay, the kidney structure, and the middle column is the one that having high amount of inflamed cell, yeah, badly damaged, yeah. So on the last one, with taking together with Lingzhi, as you can see, it actually reduce the amount of inflamed cell and maintain the kind of structure that it's supposed to be. Yeah. 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 Next is about Lingzhi research on the proteinuria of patient. So proteinuria is a condition when too much protein is passed out in the urine. So it's a sign of kidney damage. So as we know, protein is required in the blood to build muscle, repair tissue, and fight infection. So this so-called study can actually show that Lingzhi can actually reduce the proteinuria patient with the rural psoriasis. Yeah. Yep. So this is the so-called the study research found that Lingzhi can actually lower the serum glucose, creatinine, and BUN, blood urea nitrogen. So this creatinine and BUN are the waste product that we're supposed to clear off, yeah, from the body. So they actually found that Lingzhi is very good in able to actually lower the glucose and actually lower the level of creatinine. As I just mentioned, this is a creatinine and blood urea. The number should be lower, so they are able to actually lower this so-called the level. And with this, they actually can reduce the burden of the kidney on the filtration function. Yeah. Yeah. So these are the research done on this. Yeah. So for this, introducing Yongjian K Ganodermal. Now Shuang have this so-called new insert product called Yongjian K Ganodermal. For this Yongjian K Ganodermal is an upgrade version of this Lingzhi that actually help on the kidney related problem to solve this so-called to help on enhancing kidney function. So the research actually found that for those healthy mice, okay, after taking Yongjian K Lingzhi, it actually showed that the filtration rate, okay, the EGFR actually is 5 times improved over the numbers. Yeah, so look at the picture on the right, the healthy mice on top, and after the other one is the YKK. They're taking the Yongjian K. Okay, I can see during different time. Okay, after taking, you can see the so-called the highlighted illuminous area. Okay, so that area is getting dimmer and dimmer, meaning that okay, your filtration rate is higher. Yeah, the weaker the fluorescent, the so-called the highlighted area indicate fast renal metabolism. So yeah, a healthy human kidney actually we need to filter. That's how I mentioned about 200 liter of blood every day. So over 40 years, okay, years, renal function will decline by 1% every year. So early protection is very important. So by taking this Yongjian K Ganodermal, we can actually help to maintain our kidney function at the optimum level. Yeah. 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 So this Yongjian K Ganodermal, we because it's quite a unique one, and the company Shuang is able to get a lot of patent around the world, okay, from US, Hong Kong, Singapore, EU, Taiwan, China. So in terms of patent, is that it must be very unique. It must be a special. No one has done it. Then they were awarded. They will actually will award you with the so-called patent. So Yongjian K is the actually very unique one that actually come out with this product. There's a Yongjian, the upgraded version, so specifically on the so-called kidney. For dosage and vertical reaction. Yeah. Dosage for Yongjian Ganodermal. First, for prevention, we can take 4 to 8 capsules. For pre-illnesses, we can take 12 capsules and above. As for mega dose, is used for kidney failure and kidney cancer, 30 capsules and above. As for kidney dialysis patient, you can also consider taking Yongjian Ganodermal K. So it's recommended 2 sachets per day. But take note that avoid taking 1 to 2 hours before the kidney dialysis. This is to prevent that the so-called yonkin, the so-called being washed away during the dialysis. Okay, now we look at the testimonial. So this is the first one. This is the one from Taiwan. Okay, it got the so-called atrophic kidney, and from ectopic, so-called atrophic kidney, and become normal kidney. So this is a case of after taking the Lingzhi, it improves the function of a damaged kidney that due to a painkiller. So she has been taking painkiller until the so-called the kidney getting function getting affected, and the size of the kidney become smaller, the strength and the function being affected. So because of a painkiller, continue taking a painkiller. Yeah. So after taking Lingzhi, it improved the function and the function of the Lingzhi, and because it's a so-called the at the early stage, they are able to actually help the condition improve on the kidney, yeah, to become back to normal. So this is one of the testimonial. Next, we look at another testimonial. So another testimonial. This is a case of reverse from rhabdomyolysis and renal failure. So this rhabdo this so-called rhabdomyolysis is a serious syndrome due to a direct and indirect muscle injury. So it actually results from the death of muscle fibers and release of their content into the bloodstream. So this can actually lead to serious complications such as kidney failure. So so this is the so-called rhabdomyolysis. So this so-called Lingzhi Fang, okay, 49 years old, also from Taiwan. So taking Chinese and Western medicine together, and it caused this so-called problem, okay, and renal failure, and also coupled with the diabetic condition, taking combination of Western and Chinese drug together, and you start to actually have kidney failure and lead to eventually a kidney failure. So the reading for the urea is high, and at one point they need dialysis. So initial result of dialysis is not so-called promises. They went for dialysis, but it never get so-called stabilized. So his leg is also say very heavy, so very water retention because of water couldn't actually filter fast enough. Yeah, so he start taking 2 sachets of YK Ganodermal K before breakfast, lunch, dinner, and before sleep. So taken 8 sachets a day, and together with 2 sachets of normal YK Ganodermal, and taking both morning and evening. So after taking for 1 week, yeah, it showed so-called improvement, clinically improvement. So after taking he continued to take, yeah, after taking for 1 month, he went for a blood test and get the result. The result seems good, improved, okay, and he continued to take for another 2 months. So he got some side effect, okay, got anemia, tiredness, yeah. So all these side effects being reduced, okay. Yeah. Next, we'll look at the yeah. So this is the so-called the report provided by him. So as you can see from the left side, it's before, okay, the measurement before taking the Lingzhi, okay, during the so-called dialysis the time, when you start having the dialysis, this is the blood test, and after that, after taking Lingzhi, okay, for about 4 months, so we look at the so-called the blood measurement. So the urea creatinine, as we just now mentioned, it must be going lower. So the number is from 127, it dropped to 36. Yeah. So creatinine also, we want to see lower. So the rest of the marker test, albumin, you also, this is 2.4. We say it went back to 4.4. So this is the so-called the other marker on the calcium, okay, potassium, and white blood cell and platelet. So from all these results, it shows that it actually went back to a normal range. Yeah. Yes. Next. Yeah. So yeah, for other stronghold product like Luchun tea, okay, it actually helps to decrease the blood fat, and also able to help to improve kidney function. Okay, so it also can actually suppress the development of renal fibrosis. Okay, it promote uh, so-called uh, so-called renal fibrosis. It promote suppress the development of renal fibrosis. The other one will be CEO cafe. It promotes smooth urination. So with all these so-called other supplements, actually help kidney to actually filter out better and have a continue so-called good function from there. Next. Okay, now we come to conclusion. Um, yeah, health is wealth. So we have to take care before it's too late. So necessary to keep our body in a stable state. Yeah, and Ganodermal is one that can help us to balance our body system and improve the quality of our life. And Ganodermal is significantly proven and that it can suppress inflammation and protect the kidney from further deterioration, as based on just now what we can see a few of the evidence-based report. Yeah. So effectiveness of Ganodermal depend on also the dosage and the time. Yeah. So with that, I end my presentation. Thank you.